Hi, good morning. Today I'm going to discuss to you how to use Nanda to improve your NCP or the nursing care plan. Some students are not using the Nanda in creating their NCP, and this discussion will help you to determine the importance of Nanda in improving your nursing care plan for your specific patient. Okay, Nanda is the North American Nursing Diagnosis Association. I have here the two references that will be given to you as students so that you could repair the discussion appropriately with those two references. First of all, we need to identify the component of the nursing care plan. So, in your NCP, you need to use Nanda to improve your NCP. Don't just rely on the patient's data, but use what is standard based on the nursing intervention included in the Nanda. Here is the sample of nursing care plan made by students. So our case here is NCP for the patients with absolute constipation. Supposedly, the patient's data should be written on this top portion of the NCP, the demographic profile. It is because the demographic profile may help you analyze the patient condition or the chief complaint or the subjective data given by the patient. Okay, so most of the content of this nursing care plan, her basis is only on the given data presented on by the clinical instructor. So if you will read the notes, the above NCP is just the NCP taken from the data provided by the clinical instructor. You can improve it using Nanda. In the assessment, you can use Nanda to improve your subjective and objective data. It's the step-by-step procedures I will show you on the next step. Same as your FDAR is a short list of your NCP. Actually, your FDAR is your guide in creating your full NCP and vice versa. So if you have a FDAR, okay, you can utilize it. You can create FDAR using Nanda as well so that it will be properly defined, educationally prepared by nursing students. Since we utilize Nanda as our standard, that would be the basis of our nursing care. So that you need to rely always on the components of Nanda included. I have here the two references. Okay, this one. Okay, our example today is about acute pain. Okay, this if you will see on this Nanda, okay, so I will show you the cover of the Nanda. Okay, non-nursing diagnosis. Okay, 2018 to 2020, 11th edition. So this is more on focus on only on the characteristics. So let's proceed with domain 12. Since domain 12, class 1, is focusing on acute pain. Okay? So, I want you to utilize the description used in the Nanda to make it standard. Because you only write pain. But in the Nanda, there are two classification, acute pain and chronic pain. Let's proceed with domain 12, class 1. So, okay, this is class 3. Demente, labor pain. So, these are the different types of pain. Chronic pain, chronic pain. Okay, here is the acute pain. So, acute pain is being experienced by our patients uh, who will undergo surgical procedures as a result of the absolute constipation. So in the Nanda, you will see the definition and the defining characteristics. These defining characteristics will support the objective data that you will observe, that you can observe to each patient having pain. So as a result of pain, the defining characteristic is appetite change, probably loss of appetite, change in psychological parameter. Example, in the physiological parameter is guarding behavior, okay, unable to move, okay, with difficulty of moving from side to side, okay. Part din is diaphoresis. That's why there is cold clammy perspiration. So there are a lot of description that you can add as part of the objective data to support the claim of the patients that he is having pain. Masakit ang tiyan ko. Okay? So this is the first reference that you can utilize in creating nursing care plan. Another one is this one. Okay? Nursing diagnosis application to clinical practice, 14th edition. So in here, you can see our example here. Okay, on page 149. Okay, sorry, 139, sorry. Okay, I think I have got the reference. Oh, sorry, that's 39. Okay, page 139, acute pain. In these references, you can see also the definition, the same definition with the first reference that I gave you. Okay, and it's also written the defining characteristics, which is totally different from the other references. Okay, so I will show you the content. So acute pain, the definition related to surgical incision, acute pain related to cardiac tissue edema. So there are classification mentioned. So whichever fit to your patient, you need to use that in accordance or related to your patient diagnosis. Then here is the different concept or general consideration when we are trying to determine the acute pain experienced by the patient. Okay. Then the other considerations for different age. Okay. So you will see here the infant or pediatric consideration. Okay. So each age has his own consideration. And I will show you how to create it one by one. And here is the collaborative with child to intimate appropriate non-invasive pain relief modalities. Okay, even the nursing intervention needed to be given to a specific patient is written also here. So you could utilize this one to improve your nursing intervention, your planning, and your outcomes based. Yeah, oh, that's the last part because that is a chronic pain. Okay, how we should start? Okay, let's proceed with the this is the presentation of nursing students about the nursing care plan about pain. You can see diagnosis is only pain, but based on standard we need to specify what kind of pain patients is being experienced. Okay, so you need to write here acute pain. So here is the reference as stated before. Okay. Let's proceed step by step. Okay. Here, how is it being done? So if you compare the assessment, okay, from the student's preference, masakit ang sa may baba ng tiyan ko as verbalized by the patient. So you need to accurately write the exact word for that. In here, I wrote, masakit ang tiyan ko as verbalized by the patient, supported with patient's history. Patient's history is also included in the subject since you don't know the history. It's the only the patients know the history about his pain. With 4-day history of colicky lower abdominal plane. That is the description made by the patient, and that is subjective. And what are the objective? So objective here is restless, difficulty of turning from side to side with limited interaction, rated pain scale of 7 to 10. Okay, these are the different behavior manifested by the patient. But you could do a lot of this behavior based on observation. And you need to write it to support the claim of the patient. Okay, to prove that the patient is in acute pain. And I write here the diagnosis. Actually, if you will look on the FDAR I made, here is the FDAR. Okay, these are the different correction. I will give you the FD, FD, PFD file of this correction. So in here, yan. With facial grimace, inability or difficulty of moving from side to side, with cold, clammy perspiration, irritable, demonstrate a guarding behavior, lack of interest, and avoid being disturbed. So those are the description or objective description observed by the nurse or the observer. You can write this description also in your assessment to support the claim of the patient in here, in this part. Okay? So that would be an add-on. Then let's proceed with the diagnosis. So you need to refer back to Nanda to check the appropriate diagnosis. In this case, our appropriate diagnosis is acute pain. So let's look on the reference. In the first reference, it is in domain 12, class 1, acute pain. Okay, and that's correct. And the defining characteristics, appetite change, change behavior, as I mentioned in the FDAR. I mentioned the diaphoresis or the cold clammy perspiration. Okay, so I want you to see it, to look it better. Yan. Okay, evidence of pain using standard pain. Yan. Expressive behavior, yung such as facial grimace, o kaya ay guarding behavior, like the okay, all those things are written. We need to write the defining characteristic as part of the objective data. Then let's look on the other reference. Okay, first you need to identify where is pain. In here, it's in page 139. We need to enlarge this part. Yan. Acute pain. So the same thing, they have the same definition. Okay. So here is the other definition, subdivided acute pain. Then the general consideration. Okay. So the general consideration will help you to determine the root cause of pain being experienced by the patient. Okay. You can assess also the patient's threshold. This is the intensity in which the patient are capable of enduring pain. And here are the other sources of pain that might be possible. Then here is the consideration for according to age, infant, toddler, why they are experiencing pain, school age, adolescent, okay. Then maternal consideration, okay. But in this case, our case is patients for undergoing surgery. Okay, this is the goal. Okay, so I select this goal. Okay, so in the new NCP or nursing care plan, there is an outcomes identification. So part po yan ng ADOPIE. Okay, ADOPIE stands for Assessment, Diagnosis, Outcomes, Planning, Nursing Intervention, and Evaluation. So actually in other nursing schools, they combine this outcome identification and planning. Ang iba po ay they put the outcomes identification inside the planning as part of planning per se. Okay? And if you look which are the outcomes identification, you need to go to Nanda based on goal. In here, we have, I utilize the goal on acute pain, comfort level pain control. So there are three aspects. You can choose each one based on your goal. But in here, for just an example, I included all three. Increase participation in activities of recovery. That is one goal that I want to be achieved by the patient. Then reduction in pain behaviors. You need to specify what behaviors you want to achieve. And improvement in coping, in the coping of different moods or behavior. Improvement in mood or coping. Okay? So these are the three goals that I put in the outcomes identification. So this one, okay? So my reference is Nanda Acute Pain Goal, page 143. And here it is, Acute Pain, page 143. Okay. So I suppose you are being guided properly and you could follow. Next, since I already have my outcome identification, so I now therefore create my plan so that I could properly manage the outcomes identification. Okay, since we have 8 hours duty, okay, you can reduce the 8 hours as based on a smart plan. Okay, if that it would be achievable, okay, and reliable. So I utilize 8 hours so that it will be manageable since I have 3 outcomes identification. Okay. So here, after 8 hours nursing intervention, the patients will be able to 1. Verbalize the intensity of pain from 7 to 10 to 3 to 10. Always uh, refer to the highest scale to the lowest scale. So I want to achieve the 3 to 10. This plan is based on uh, the objective of rated pain scale here on this part. Okay. Next is 2. My second plan is participate in the nursing intervention and surgical management. Okay, this is to address this one in the outcomes identification, increase participation in the activities of recovery. So my plan is participate in the nursing intervention and surgical management since the patients will undergo surgical procedure. Next is turn from side to side without facial grimace. So this one is to address the reduction of pain behavior. So what are the pain behavior? Specify that is facial grimace. When you are turning from side to side, in the next level, the patients will turn from side to side without facial grimace anymore. It means the pain are reduced because the facial grimace will tell you that the patient is in pain. Next is improve in mood coping. So interact with other activity in the management of care. So when the patients interact with other activity in the management of care, so the patients, you can identify that the patient is improving in his mood coping. Okay, because he can now interact with the different activities in the management of care without facial grimace, without restlessness, without diaphoresis, or without guarding behavior. So those are the things we need to achieve in patient. Now, since we already placed the outcomes identification and plan of care according to presented, note, I put here a note, apply what suits to your patient. Don't just copy all, but fit it according to patient's needs and fit it according to outcomes identification or in accordance with the diagnosis. Now, let's proceed with the nursing intervention. Okay, here are the nursing intervention. So first and foremost, when the patient is having pain, we need to establish rapport to develop trust and to promote participation in the management of care needed. So we are trying to address this 1, 2, 3, and 4 planning. So first of all, so acknowledge pain as verbalized by the patient. Actually, I think yan, acknowledge the students wrote here, administer medical, encourage patient verbalize of the feelings of pain. So he write it there. Take note, our nursing intervention should be written accordingly based on independent nursing function, dependent or interdependent or collaborative nursing function, and dependent nursing function. So the last resort is if we will provide, because I did not write here the dependent nursing functions, which is the administration of medication, particularly for pain. I will address that on the later on. So those would be the arrangement in the nursing intervention. I repeat, it should be independent, interdependent or collaborative, and last is dependent nursing function or intervention. So after acknowledging the pain as verbalized by the patient, it will help to promote the development of rapport and trust between the nurse and the patient. Another thing is to listen attentively to the client's discussion of pain. Okay, because that is subjective. Don't argue with the patient. Okay, then convey that you are assessing the pain because you want to understand it better, not to determine it if it is really exists. Okay, so we are being subjective here. So as a result of this nursing intervention, you will gather the results of 7 to 10. Okay, and later on, you need to utilize it again so that we could get the 3/10 results of the pain scale. Next is conduct health teaching. This is your opportunity. So where did I get these 3 nursing intervention. It is based on the Nanda. I I did not get it from my mind or just a wild guess, but I have a reference. How did I get that? So I use the second reference, this one. Okay. So in here, I use the reduce or eliminate factors that increase pain. So I utilize this one on page, this is on page 143. I think I write here, page 1, refer to page 143. Okay, so here, I get it here from this side, disbelief from others, or reduce or eliminate factors that increase pain. So, establish supportive acceptance relationship, yung establishing rapport, and I insert this three aspect. Okay, I only utilize those part. Okay. One, to listen attentively to the client's discussion of pain and convey that you are assessing pain. So, I utilize Nanda so that I have a good nursing care plan. Okay. And that will be an opportunity for you, okay, to conduct health teaching. Okay. So, where I get my health teaching per se. Okay, this is my health teaching. Okay. Explain the concept of pain. So, I get my health teaching based on Nanda. So, when you talk about explain, discussion, encourage, okay, here it is. Okay? That means you are conducting health teaching. Okay? So you don't need to create more on you have a reference and use that reference which is available in the Nanda. Okay, so that your discussion on your nursing care plan is based on standard. Okay? So now you know the reference to conduct health teaching. I want you to utilize it on your next nursing care plan. And you need to always refer to Nanda where to get the health teaching needed by your patient. Okay, this is also part of the assessment. Okay, assess the family for any misconception about pain and its treatment. But you could utilize this also to the patient himself to explain the concept of pain as an individual, so that you will be able to identify the content. This is on page 143. So explain the concept of pain as an individual experience. Discuss factors related to increased pain and option to manage. Encourage family members to share concerns privately. Okay. So there are a lot of description where you could use the Nanda to improve your nursing care plan. Okay. So here I get it from that page. Okay, next. Check patient's tolerance of pain. Okay? So, you could not uh, do nursing intervention when the patient is having pain without checking patient's tolerance of pain, because you could not address how the patient could bear those activities if the patient is having pain. So, to be able to participate, so you need to check the patient's tolerance of pain. It's also in the Nanda. Okay, I think I showed you before the tolerance of pain somewhere here. Okay, uh, on the first part. Well, anyway, it's all here. You could refer back the tolerance of pain. It's been discussed here. Okay, the patient's tolerance of pain. And it's very important that we as a nurse to determine that so that the patient will be able, this one, okay, pain threshold, it's there, okay, so that the patient, you could evaluate the presence or participation of patient to all nursing interventions you will be doing to your client. Next, teach the client to avoid negative thoughts about ability to cope with pain. So this one refer to page 145. Page 145, we are 141. Okay. So let's proceed with page 145. Here is how to go through the different page of the Nanda. Okay. So collaborative with the clients about possible methods to reduce pain intensity. Okay. So client's willingness or ability to participate. Okay. So it's written there. Support the methods, client's willingness. Okay. Number 145. Just wait a minute. Okay. Then, here. Explain the therapeutic use of method preparation, but I utilize here. Let's see what I use. Teach the patient to avoid negative thoughts. Okay. Teach the patient about negative thoughts. Okay. Here. Teach the client to avoid negative thoughts about ability to cope with pain. Another one is participate, practice distraction. Okay. Practice distraction. Yung practice distraction and guided imagery music. Then practice relaxation. So all are here. Okay, taken from Nanda. So now you will see the how it's good to read when we are making academic uh, preparation on the nursing care plan. So it means I base my nursing care plan on the standard, which is the Nanda. Okay, I also include provide expected desired output to participate in the nursing intervention. Okay, this is my own. Okay, based on the nursing objectives or assessment based on objective data. Okay, provide expected desired output to participate in the nursing intervention, turning from side to side to address this one, to address the plan number 4, interact with other activity in the management of care. Okay, provide expected desired output to participate in the nursing intervention. This means that you will give a step by step so that the patients could achieve little by little those nursing intervention or management of care. Example is personal hygiene. If the patient is having pain, he could not render his personal hygiene because of pain. But if you give the patient the desired output, that this day you could brush your own teeth, and next week you could clean your own body, and next day you could do another thing. So every day you are providing the patient's care. But in here, since our objectives is only 8 hours, so you have to determine a specific output for that day only, or for the 8 hours. Okay, in my example is personal hygiene. Example is brushing the teeth or cleaning or wiping the body with a towel. Such an example will greatly help the patients to determine the expected output or desired outcomes for the patient to address your plan of interacting with other activity in the management of care. And next here, as I said, that is, as you can see, most of here is all independent nursing intervention. But if there is a collaborative effort, you could add here the collaborative. since we don't have collaborative, I will just add the dependent nursing function, which is written also here in the Nanda. Okay, the giving of, here it is, yan, the provision of medication. So these are the uh, non, the dependent nursing intervention for our patient. So you can write here the dependent nursing function, that is administration of medication for pain. Okay, you can specify what kind of medication. Example is tramadol. In giving tramadol, you need to exercise also your nursing responsibility to check to check the BP, the blood pressure. Okay, because if the patient is having high BP, okay, so you should not give the tramadol. Okay, that's an example of the dependent nursing function. So you need to repair this on page 145. Okay, then evaluation is the same thing. Okay, you need to write at the end of the shift, the patients will be able to, this is our expected evaluation, verbalize the intensity of pain, okay, which is 3/10, supposed to be 3/10. Participate in the nursing intervention and surgical management. So this to address our plan number 2. And to turn from side to side without facial grimace. This to address the plan number 3. And interact with other activity in the management of care, which is plan number 4. And as you can see, all the outcomes identification has been addressed using Nanda. Okay, that is the importance of Nanda in creating an academic, well-prepared nursing care plan. I hope you like it and you are being guided by this demo or this discussion on the NCP. I hope you like it. Kindly share it to your classmates, to other nursing in other nursing school, so that we could help them also achieve an academically prepared nursing care plan. And that is what we expected to all nursing graduates in the future, that they follow the nursing standards of care based on Nanda. So the only help you could make me is to subscribe, like, and share. Uh, you learn without expecting anything from you or from me, and that's the only thing that you could help me to subscribe, like, and share. So that would be a great help. Again, please subscribe, like, and share. Thank you very much, and God bless you all.